It's a health crisis across America. 100 million Americans have above normal cholesterol. 34.5 million have high cholesterol. 1 in 3 have high blood pressure, and 1/3 don't know it. 21 million have diabetes. 63% are obese. These numbers are startling and can eventually cause stroke, heart attacks, kidney disease, and even lead to the need for transplantation. There are hundreds of thousands of people waiting for a life-saving organ transplant that can take months, even years. Every day in the United States, 20 people lose their lives as time runs out. Donald Arthur knows what it means to wait day after day for a call that can literally save his life.
I had gotten a phone call, and my cardiologist said, "We have a heart for you." And my first response was like, wow, I was freaked out because it was just something I wasn't really prepared for. And I hung up the phone, and I remember crying because I understood, when you get that call, someone's died.
No group knows the anguish of waiting an organ match more than minorities. While ethnic minorities must be commended for doubling the number of organ donors from 15% to 30%, there is still enormous work to be done.
There are so many minorities in need of organs because we're disproportionately afflicted with hypertension and diabetes. When you look at the comparison between blacks and whites, we're almost 2 to 4 times as frequently as whites.
Compounding the problem is a severe shortage of minority donors. Both living and deceased donors are needed to save lives.
Minorities represent 25% of the population, but on transplant waiting lists, we represent 50% of those people waiting for transplants. So even though minorities are donating in excess of their proportion of the population, we're still donating at 30% when we actually are in need of 50%.
When Jessica Ward died suddenly at 19, her family was proud to help others by donating her tissue.
We donated her tissues, which included the bones in her arms and legs and the sac to the heart that the heart sits in, the pericardium, which is used for neurological surgery procedures. We also donated the valves to her heart, which are used for congenital heart patients. We also donated her Achilles tendons and skin for burn victims. To us, Jessica was a hero. She was a loving and giving person, and we felt what better way to honor her because she was so full of life, and to give that life, to share that gift of life with someone else.
I never thought in a million years that by having a heart transplant, that my life could have blossomed so much. I've done a marathon now in 30 states on my journey to do a marathon in all 50 states to promote organ donation. It really hurt knowing someone died, but yet that family, out of all the pain that they were in, that they were still willing, to donate their loved ones' organs and to save my life.
Becoming an organ donor means giving someone else life, but the best way to save your own life is to take care of your health and start young.
I think it's important for young people to take care of their health now because in the long run they wouldn't want any problems that they could have prevented earlier. And that I know that you wouldn't want to just sit around and think, oh, I can watch TV and play video games when you could be outside playing games and helping your body and taking care of yourself.
Exercise 30 minutes a day, 5 days a week. Push back from the table, lose weight, get your blood pressure checked at least once or twice a year. Get your urine checked to see if you have any protein. The lasting message I would like to leave for minorities is that love yourself, take care of yourself.
The National Minority Organ Tissue Transplant Education Program, or MOTTEP, is a leader in educating the minority community about improving overall health and organ, tissue, bone marrow, and blood donation. National MOTTEP partners with community organizations around the country to get the word out about the desperate need for organs and tissues donated by minorities.
MOTTEP's mission is to increase the rate of donors and decrease the incidence of end-stage renal disease development. We accomplish this by going into the communities, educating and empowering the communities to live healthy lifestyles so we can decrease the incidence of end-stage renal disease, and by increasing donation rates, and also sign donor cards, have family discussions, leave organs and tissues in life and after death.
National MOTTEP was founded by Dr. Clive Callender, a transplant surgeon at Howard University Hospital who is passionate about getting minorities to understand the importance of organ tissue donation and better health practices and behaviors to prevent the need for transplantation. His efforts have been a success. Since Dr. Callender embarked on this mission 3 decades ago, minority donations have nearly tripled.
Receiving a liver, in my case, helped save my life, and I was able to really, accomplish some of the goals I had in life, and also be able to accomplish all the long-term goals. For those people that are watching this video, they can look at me as being an example of how your organ, if you donate your organs, you can see that I am a walking, talking, living individual. And I was definitely on my deathbed before actually receiving this organ. So it does work. The process definitely works.
It's difficult to describe the sense of gratitude that one feels as a tissue transplant recipient. In my case, receiving a cornea transplant took my vision from some 2400 in the right eye to correctable to 2040. It allowed me to have an ongoing 25+ year career in surgery.
If I had something that someone needed and my body would regenerate it again, what difference did it make? It was what you're supposed to do to help someone. So that's why I did it. People say, well, you don't even know the person. So what? You didn't have to know someone to help them.
In a country where 4,000 to 5,000 people die a year, that's almost 100 people a week in some weeks, waiting for organs. What a shame it would be for us to just bury healthy organs, a heart, 2 lungs, 2 kidneys, a pancreas, a liver. Literally, a patient could save 5 or 6 lives of a person that we'll never see.
Whether you're donating blood, bone marrow, or organs, you will help save lives. And it's the most precious, precious gift that anyone could give to another human being is life.
People must understand that only 6% of African Americans looking for a marrow transplant will ever have one, because minorities are underrepresented on their national registry. And it's just so simple to join the registry by filling out a consent form, and today it's not even drawing blood, it's just a swab of the cheek.
I think it's a good thing for people to be donors. It's a way of giving back. Even though your loved one has gone on, you still have a way to memorialize them and to know that you have helped someone else.
If you would like to become an organ donor, tell your family. But first and foremost, love yourself and take care of yourself.
We have visions of National MOTTEP addressing telehealth and going into the communities to take care of chronic health like hypertension and diabetes by using health information technology that the community does not have access to as yet. Addressing stem cell transplantation, issues that the community has not recognized as important. So our future, I think, is great because the minority community is often on the outside looking in. And with community education and empowerment, they can be on the inside looking out.
For more information, visit mottep.org.
Give the gift of life. Give the gift of life. Give the gift